How has fever treatment evolved for surgical recovery? Imagine a time when doctors immediately gave strong antibiotics for every fever after surgery. Now, things are quite different. Fever after surgery is common and often part of the body's healing process. It is not always a sign of infection. In the past, doctors treated all fevers aggressively, testing and giving antibiotics right away. But now, we understand that many early fevers, within the first 2 days, are caused by inflammation and immune responses. These are natural reactions, like the releases of substances called interleukin-6, which help the body heal. Because of this, treatment has shifted to a more careful approach. Instead of rushing to give antibiotics, doctors now assess the timing of the fever and other symptoms. If the fever appears early and there are no signs of infection, they usually recommend supportive care. This includes drinking plenty of fluids and taking medications to reduce fever, like acetaminophen or ibuprofen. These help keep the patient comfortable while the body heals naturally. The focus is now on the WS to find the cause of the fever. The first is wind, which refers to lung issues like pneumonia or blood clots in the lungs that can cause fever after the second day. The second is water, meaning urinary tract infections often linked to catheter use. The third is wound, which points to infections at the surgical site. The last is what did we do, which includes drug reactions or reactions to blood transfusions. If a fever lasts longer than 2 days or is accompanied by symptoms like cough, redness around the wound, or painful urination, then doctors order specific tests. These tests include blood cultures, urine tests, chest x-rays, or wound swabs. This targeted testing helps avoid unnecessary antibiotics and reduces the risk of antibiotic resistance. In rare cases, very high or unusual fevers may be caused by serious reactions like malignant hyperthermia, a rare response to anesthesia, or gas gangrene, which needs urgent treatment. These situations requiring immediate use of specific medications like dantrolene or surgical intervention. Overall, fever management after surgery has become more precise. It is no longer about treating every fever aggressively but about understanding its cause. This approach helps prevent unnecessary side effects from antibiotics and supports the body's natural healing. Patients should know that mild fevers early after surgery are common and usually not dangerous. But if a fever persists or becomes very high, or if other symptoms develop, it is important to contact a healthcare provider promptly.